Well, here we are with Dr. Bensianoff again. Dr. Bensianoff, let's talk about missing teeth. And let me ask you something. Many patients, people like me, we quite often do have a few missing teeth in the back, and we don't fix them for a long time. And the reason I say in the back, because if we do have one missing in the front, we usually do fix it rather fast because it's awful ugly. But in the back, we seem to be not so fast with fixing it and replacing it. And it doesn't look like to most of us that something really big is happening. It doesn't look like, the house is falling apart. And yet, you dentists keep telling us that we must fix it because it creates problem. Can you shed some light on this discrepancy, why you're pushing it so hard, thinking that it has a health impact, and we think nothing happens? Go ahead.
I'd be more than happy to do that.
Go ahead.
Well, it's not the first time I hear something like this. Patients come in and they tell me, listen, there's a tooth in the back that's missing. I don't care about that. But there's a little chip in the front, and that's bothering me the most. And of course, aesthetics are, which is visible and real to the patient, that's what their major concern is. But, let's talk about the back teeth for a second. We chew most of our food with our back teeth, which are the big molars in the back. And once one of the, if we lose one of those back teeth, then teeth never stay in the same place. They always move and they shift. What happens is, once there's a missing tooth, the tooth behind it is going to start moving forward, and the tooth on top of that tooth, on the opposite arch, on the opposite jaw, will start dropping down. And that can create a whole cascade of different problems as far as chewing abilities, as far as TMJ, which is the joint that attaches the lower jaw to the skull, problems.
That's those hinges here, right?
That is correct.
Okay.
And also, once we start putting more force on the front teeth, then that creates the problems for the front teeth as well, because they're not designed for chewing food. They're mostly for cutting food. We chew most of our food with our back teeth. And once one of those back teeth is missing, and we put a lot of force on the front teeth, then we create more problems for our front teeth as well. So it's essential to have all of your back teeth in place, because they protect the front teeth as well as they increase your chewing abilities.
Tell me, you said that the teeth start shifting. Are you telling me that they start shifting the way, let's say, a fence? When you have the fence and then, one of the balls gets a little bit wiggle-woggly and it starts shifting and it starts looking ugly as well as losing its functions. Dog and cats can go in and out and it looks ugly. Are you telling me that that's what's happening with the teeth, that they start shifting? And did you say they shift, because they shift, they now move, the whole thing starts...
Absolutely, this is a great analogy. What happens is that is correct, they start shifting, and not only it creates problems as far as the chewing, it also affects the teeth as far as the gum problems, because you get what's called an infrabony pocket. That means you start losing bone around that tooth that's shifting.
Right, I've heard about that.
Yes, it becomes a whole cascade of problems if it's not fixed in a timely manner.
So once you start losing bone, is it true that when you lose bone, of course, maybe one tooth might not be the end of the world to lose, but you start losing bone, so because of it, the other teeth next to it kind of like start again more becoming wiggle-woggly and moving out? And when you do lose bone, is it true that it kind of changes your facial structure? You start having a caved-in face, or maybe a flat face, or anyway, is that true that it can go that far?
It can. If you eventually lose all of your back teeth, that is a possibility as well. If you lose one tooth, it's not going to be that drastic, but it will affect the other teeth, absolutely. And once it affects the other teeth, you might end up losing the rest of them as well. And therefore, fixing, even one tooth missing in the back can lead to losing other teeth. So eventually you can have the concave, sucked-in face and all of that.
Right.
consequences of not
Basically,
fixing.
you lose one cogwheel, you're soon going to lose a bunch of other ones. Being a mechanical machinery engineer, that's kind of how I can see from the way you explain it. This is happening. Now let me ask you this: if the teeth start shifting, and you said something about called DMJ, the hinges, again from a mechanical viewpoint, things start shifting. It is because of that, I've heard, and you tell me whether it's true or not, that people can get headaches, shoulder pain, back pain, even neck pain, stiffnesses at least, simply because it all starts shifting and it's all connected. Is there some truth to that?
Absolutely. Yes. TMJ problems, or that hinge that we are talking about, once you have problems in TMJ, which starts like an innocent clicking when you open your jaw, you hear a click, can lead to a lot of different problems, such as, and not limited to, headaches and ringing in the ears, constant ringing in the ears, and like a pain and neck stiffness. You're absolutely right.
So very obviously, just from looking at that viewpoint, many of us, the chewing effect, might not be so bad to us, even though it is bad. But, like me, when I sit down with my wife eating, she has the first 3 pieces of salad still in her mouth. I'm done with my steak. And, which means I don't chew very much. So I kind of would tell you, chewing, who cares? I don't chew anyway. But, and of course that's bad. But the point is, if you run around with like tension, don't sleep so well, wake up with a stiff neck, a little headache throughout the day, that looks pretty, that looks like it affects your life, your ability to work, your ability to have fun, and it's not fun. So if there's any reason that your missing teeth could contribute to that, I could see that there's a reason why you want to fix them for sure.
Yes, the effects of the joint disease can be very detrimental, and teeth contribute a lot to this problem. So absolutely, you're absolutely right. That needs to be fixed in a timely manner to prevent those headaches and all the unpleasant consequences from happening.
Right. Well, thanks for your candidness. Thanks for clearing that up for me. I know I've heard about it before, and it's good to hear it from a professional who says, yes, that can be done. So let me ask you this, one last question. If a person maybe has missing teeth, maybe he doesn't, and he has like shoulder pain, headache, and he has tried to go to a chiropractor, and he did a few things, but it doesn't quite go away. Would it be prudent for him, would it be wise for him to go to a dentist who understands this thing and get at least checked? Maybe it's the cause, maybe it's not, but at least he will find out. Would that be a good, wise step for him to do?
I think it's a great idea. There are different contributors to headaches and neck pains, right. And to rule that one out, it's definitely a good idea to see a dentist to make sure that's not the cause, because a lot of times it is.
Thanks a lot again. Bye-bye, Dr. Bensianoff.
Thank you, Helmut. Take care.